Record. Yes, will do. Awesome, y'all. So thank you so much for being here today. We're so excited to have you join us on this phenomenal event. Thank you for joining us today for Positive Women's Network USA's World AIDS Day event, Rise Up, Women Living with HIV, Demand Action. My name is Breanna Diaz. My pronouns are she and they, and I am the policy director for PWN USA. And today we have an incredible panel of advocates, activists, and just amazing women to unpack the federal HIV response and what's lacking in it for women living with HIV and ways that we can take action to improve it and ensure that the next iteration of the federal response meets the demands of women living with HIV. I'm going to briefly introduce our amazing panelists, and then we'll get started with a brief presentation followed by a moderated panel discussion. And of course, we will have time at the end for question and answers with you all, as we really want to have a conversation. So if you have any questions throughout this event, please drop them in the question and answers box or in the chat. I will do my best to make sure that we address any questions you bring up. But with that, let's get started. So today we have 5 amazing people. First off, I would like to introduce Vanita Ray, who is the co-executive director of PWN and has served in underserved communities for over 30 years in a variety of roles, including managing an advocacy training program for people living with HIV, and was involved in the 2016 drafting the roadmap of ending the HIV epidemic in Houston. Vanita advocates for issues that intersect with HIV and impacts the lives of people living with HIV, and Vanita is deeply committed to equity, racial justice, and developing leadership and meaningful involvement of people living with HIV in all decisions that impact the HIV community. Thank you, Vanita. We also have Nana Khanna, who's the co-executive director of PWN. They are a national speaker, trainer, and advocate, and has worked in the HIV field since 2005, following her HIV diagnosis in 2002. She currently serves on the board of directors for AIDS United, the National Steering Committee for HIV Justice, Racial Justice Now, and served on the President Obama's Advisory Council on HIV/AIDS, or PACHA, from 2010 to 2014. There's so much more to go into Nana, but we'll move on. Next, we have Cecilia Chung, who is the Senior Director of Strategic Initiatives and Evaluation at Transgender Law Center, is a health commissioner of San Francisco and an internationally recognized civil rights leader in the LGBTQ and HIV community. Cecilia has served as the co-chair of GMP+, and in 2015, Cecilia founded Positively Trans, a network of transgender people living with HIV. She's currently a member of the WHO Advisory Council of Women Living with HIV. Thank you, Cecilia, for joining us. Next, we have Martha Cameron. Martha is originally from Zambia, Africa, where she was born and raised. She's the executive director for the International Community of Women Living with HIV North America. And most recently, Martha worked as a director of prevention for Women's Collective, a leading community health and human service agency in Washington, D.C. And finally, we have the amazing Pat Kelly. Pat Kelly is a native New Yorker who currently resides in Orangeburg, South Carolina. She is aging gracefully and gratefully. And in 1985, she was diagnosed with HIV and AIDS in 1998. Pat is a mother of 3, a grandmother, a great-grandmother. And in 2005, Pat founded a family affair of HIV/AIDS ministry. And in 2008, Pat was among the first class of Positive Voices Women's Health Advocacy Network and the Photo Voice Project, and she's also a founding member of Positive Women's Network USA, as well as a former board member. Wow. Sorry, Vanita, did you have your hand up? Or? Okay, you're just okay. You're raising it up in celebration of this amazing panel. Yeah, well, thank you so much. Again, I am going to quickly walk us through a presentation that provides a brief background on our event today, or why we're here today. So let me share my screen. Excellent. Awesome. So welcome yet again. If you're just joining us or watching us on Facebook, please feel free to introduce yourself in the chat and tweet with us throughout this event at USPWN. Our hashtags are demanding better and hashtag WAD 2021. Please engage in the conversation. So what are we hoping to achieve in this event today? Everything. But no, really, what we are hoping to get out is we want to learn more about the federal HIV response. And what I mean by the federal HIV response, I mean the National HIV/AIDS Strategy, or NHAS, and the Ending the HIV Epidemic, or EHE. We're also going to learn more about the Demanding Better policy agenda, the first ever federal HIV policy agenda by and for people living with HIV. We're also going to understand how the federal HIV response impacts women and people of trans experience living with HIV. And we will finally, we will provide ways that folks today can get involved with PWN's efforts to improve the federal HIV response for women and people of trans experience living with HIV. We will accomplish all of these goals today, I believe it. So a little bit of background for folks who might be new or just joining us for the first time. So a little bit about Positive Women's Network USA. We are the only national organization in the US led by and for women and people of trans experience living with HIV. We were founded in 2008 by 28 diverse women living with HIV, including women of trans experience. Today, we have over 3,000 members nationwide and are growing. And we have incredibly active chapters leading amazing state legislative and policy advocacy work and community organizing in Colorado, Louisiana, Texas, South Carolina, as well as state leads in another 12 states. I'm sure there are PWN members here today that are happy to share their work in the chat, as it is robust and powerful. And our mission is to prepare and involve women living with HIV in all our diversity, including gender identity and sexual orientation, and all levels of policy and decision making. And that is why PWN is proud to have co-authored and led the development of Demanding Better, and is co-leading all these advocacy efforts to inform the federal HIV response. It's our mission. So I know I've said demanding better several times. So I'm quickly going to kind of provide a foundation so we all have a shared understanding of what is demanding better. What does the policy agenda address? What are the issues it has highlighted, and what are the recommendations for each one of those issues? Our panelists will further unpack those, but right now we're just going to do a little brief background. So Demanding Better is a policy agenda by the US People Living with HIV Caucus, or the caucus. And the caucus is comprised of organizations, networks, or client groups of people living with HIV, like PWN, like Positively Trans, Zero, and so many more. The caucus is founded on the belief on the principles of self-empowerment and self-determination. Again, like there are so many networks of people living with HIV that the caucus encompasses and represents. And the caucus is organized groups created and led by and accountable to people living with HIV in the US. And all of our panelists are staff members and folks that fall under these networks. So we're going to get a whole lot of perspective today. So what is Demanding Better? Demanding Better is a call for the federal response to HIV, again, that is the NHAS and EHE, to uplift the dignity, human rights, and wellness of all people living with HIV in the US. For decades, the federal HIV response has unfortunately been rooted in a biomedical understanding of HIV, linking viral suppression to success, as well as ending the epidemic. But we know, as networks of people living with HIV and allies, that it takes more than a biomedical response to truly end the epidemic and ensure folks living with HIV can live the most equitable and high quality of life capable. And so after 40 years, the domestic HIV epidemic continues to be driven by social detriments and structural inequities. Those include racism, specifically anti-Black racism. It includes gender inequities. It includes homophobia and transphobia, poverty, a broken healthcare system, one that has been exacerbated by COVID-19, and systems that criminalize people, including HIV criminalization. So what Demanding Better is that we have provided a clear roadmap for the administration, right now the Biden-Harris administration, and Congress to achieve the goal of ending the epidemic and improving quality of life for people living with HIV. Here's the link if you want to check out Demanding Better. We will also post it in the chat, but we really encourage folks to take a look at it and see what we've addressed. So within Demanding Better, we cover 6 issue areas: integrate meaningful involvement of people living with HIV or MIPA, creating a human rights environment, addressing racial and gender disparities, inclusion of sexual and reproductive health and rights, adding sex workers and immigrants as priority populations, and finally, ensuring quality of life for people living with HIV throughout the lifespan. That includes folks aging with HIV. Quickly, so for MIPA, our folks will unpack these recommendations more, but here are just a couple. I think one that we really want to uplift today is that we call on the federal advisory bodies, such as PACHA, CHAC, and ORAC, to be rechartered to include institutionalized seats for representatives of networks of people living with HIV. We will unpack that more. We also want to ensure that the federal HIV response includes MIPA indicators and future federal plans. For creating a human rights environment, we believe that in order to successfully end the epidemic, we have to do things such as requiring EHE jurisdictions to create plans that incorporate activities to reduce stigma and to end HIV criminalization. We have to declare a moratorium on MHS until community concerns are met. And we have to partner with networks of people living with HIV to develop standards for data collection, as well as security sharing and storage protocols for HIV data. For racial and gender equity, we have to invest in Black, Indigenous, and people of color-led HIV organizations. Unfortunately, we know that this is not happening, and there is no way we can end this epidemic without investing in the communities that are disproportionately impacted by the epidemic. We must also ensure that there are trans-responsive care and treatment throughout HIV prevention and care systems. Inclusion of sexual and reproductive health and rights. We have to include goals and metrics that focus on improving the sexual and reproductive health of people living with HIV, right? Like, we have to ensure that, excuse me, that there are metrics for increased rates of recommended second pap smears, counseling of fertility desires and intentions, and so much more. We also need to make sure that we are discussing and funding research into safe practices for folks living with HIV that are breast or chest feeding their children. This is still a criminalized activity. It's insane. For sex workers and immigrants, we call on this administration to add sex workers and immigrants as priority populations in the federal HIV response. We also want to ensure that we are funding language services for folks that where language is a barrier to accessing care. And with that, that was really quick, I know, but I want to turn it over to our panelists. Oops, no, that's not what I want. Stop share. So with that really brief background, I'm going to turn it back over to our panelists and open up with just a few framing questions, if I can find my doc. Apologies, everybody. Awesome. So, Nana, I'm going to start with you for a few introduction questions. Would you provide a brief background on the federal HIV response for women living with HIV?
Yes. Thank you, Breanna, for that powerful introduction and overview. And so as I talk about the federal HIV response, I want to also back up and talk a little bit about why we're having this event today. So as folks know, and as Breanna mentioned, tomorrow's World AIDS Day. We know that there's a new national HIV/AIDS strategy coming out this week, any day now. The federal response to the epidemic is primarily guided by a couple of national strategies that sort of all of the domestic response to HIV is situated inside of those strategic plans that cross government. And so, for years, Positive Women's Network, our predecessors, our movement mothers, and others have been fighting to make sure that the response to the epidemic in the United States and globally is squarely situated within a context of human rights and justice and racial justice and gender justice. And we've had to continue to fight for that because it hasn't always been. And so in the United States, the HIV epidemic itself is circumscribed by so many different systems of inequity and inequality, from racism to transphobia, homophobia, HIV stigma, criminalization of our communities, as Breanna has talked about, from racist policing practices to policing of folks for walking while trans, to criminalization of HIV itself, of sex work, of people who use substances, criminalization of homelessness. We cannot effectively address the HIV epidemic without actually upholding human rights for all people in the response. And so, although the US had for many years, through our federal funding that we were providing globally through the PEPFAR program, the President's Emergency Plan for AIDS Relief, the US have required other countries who receive that funding to have country level plans to address their epidemics. But in the US, we had never had one until the HIV community actually started fighting for it during the years of the 2008 presidential election cycle. So in 2007 and 2008, HIV advocates across the country started coming together and saying, we are calling on the next president, whoever that president is, whether it's whichever party that president is from, and whoever that person is, to declare a national AIDS strategy for the United States, just as we have been holding other countries accountable to this for a very long time. In that election cycle, the Coalition for a National AIDS Strategy was successful through community pressure in getting all of the major presidential campaigns towards the end of the election cycle to commit to that. So including different political parties, the top candidates did commit to having a national AIDS strategy as part of their presidential platforms. And so in 2008, when President Obama won the election, we were ready and mobilized to hold the incoming administration accountable on those commitments. And so at that time, I think it's also important to name that, like, the Coalition for a National AIDS Strategy, there was a lot that had to be done to ensure that women, trans folks, Black folks, people of color were adequately represented at the table that was even calling for the strategy and the priorities that were being set by the community, right? And this is a consistent struggle that that folks have had to deal with throughout the epidemic, is making sure that people living with HIV, Black people, communities of color, low-income folks, those who are most directly impacted and harmed by HIV and the systems that make the HIV epidemic possible, are at the tables. And so when we did get that national, the commitment for a national HIV/AIDS strategy from President Obama, part of what we pushed for was to make sure that our communities were really centered there. And so in 2010, the first ever national HIV/AIDS strategy was released by the Obama administration. It was a 5-year plan. It was then followed by a second 5-year plan that went from 2015 to 2020. And both of those plans were really laudable. They did significantly advance us in terms of having a coordinated cross-government, multi-sector effort to address the epidemic. However, there were lots of places we had to keep pushing, right? So the first strategy, for example, didn't include, it was missing a lot of really important context for how we would respond to the epidemic among transgender women, for example. It was also really missing a clear focus on things like HIV criminalization and these structural human rights issues. And so through advocacy over the years, we have come together to keep moving the bar. And over the last 10 or so years, there have been a number of changes in the external environment that have also changed how we need to be advocating and what needs to be in these federal plans. And so we need more than just a coordinated domestic response. We need a coordinated domestic response that centers those communities that are most directly impacted and most harmed. We've had tremendous successes in things like biomedical prevention and treatment, so that we actually have every single tool that is needed to, quote, end the epidemic in the US. We have it. We have those tools. We have viral suppression. If everybody living with HIV is virally suppressed, we can actually end the epidemic, right? We have tools like PrEP, which is pre-exposure prophylaxis. That is another biomedical tool that basically can prevent HIV acquisition. But we see, as we look at rollout of these types of tools, we see extreme inequities and disparities in who has access to them. It's not a coincidence that like half of people living with HIV are not really in consistent care or virally suppressed in many situations, and folks are still dying and suffering. And so that's because our systems are broken. And so we are calling on this new administration, which is also releasing an updated national HIV/AIDS strategy this week, to really take these kinds of structural issues, racism, gender injustice, misogyny, trans misogyny, the way that things play out at structural and decision-making levels, to take the fact that our healthcare system is not only fragmented, but it is really controlled, it is really like led by and dominated by uncontrolled capitalism. So to really look at all these different pieces and develop a response that centers our rights and our dignity. And so that's how we came together as a group of people living with HIV networks for the first time ever in history this year, to put together a coordinated collective plan that we believe will help to move the HIV response forward significantly. This is a living document. It is one that we have already iterated and plan to continue iterating. And it is a collective call from networks of people living with HIV who collectively represent tens of thousands of people living with HIV on the ground from the communities most impacted by the epidemic, to really recenter the response around the needs of people living with HIV, because we'll still be here even when the epidemic has, quote unquote, ended, right? There's 1.2 million of us. We don't plan to go anywhere. You cannot end the epidemic without us. You need us as partners. You ought to perceive us as partners, and we plan to not only survive, but to thrive. And we demand the right to live with dignity and with pleasure, right, for as long as we're here.
So that was quite the unpacking of a background, but so desperately needed. Thank you, Nana. Vanita, I'm going to ask you another question. What does PWN see as priorities that should be included in the federal HIV response? And how is the new INHOS adopting these priorities?
All right, well, thank you, Breanna. And Nana, I think, laid it out pretty well. And I just want to say, for those that don't know me, I am also a woman living with HIV, if you don't know. So the way I'm showing up is that way. But I think Nana laid that out. And the kinds of things that should be included, is, first of all, what they fought for a long time ago, the inclusion of women, right? And women and people with transgender, address our issues. Most medical research on meds and everything else is white cis men or others. And so, there were folks like Katrina Haslip and others who fought for the inclusion of women's opportunistic infections just in the definition of AIDS as a whole. So, there used to be a saying, we don't get AIDS, we just die from it, right? So, and mind you, that hasn't been easy. Organizations like PWN and others have had to fight for gender related, kinds of issues and funding in these plans. So first, just the inclusion of us and all of our diversity. And I don't mean that just trans women, because trans women are women. I mean, in our diversity of gender expression and everything else. So first of all, just that. And then secondly, and for the first time, I just heard this mentioned by, I think, Rachel Levine, that we have to acknowledge that racial injustice and gender inequity is the driver of the epidemic. If it was about taking a pill or meds, we'd all probably be there. But most of our response and the biomedical response is about what I call topical approaches. They want to fix the leaf on the tree instead of the root cause of the problem. And so what we want to see addressed is those human rights issues, those gender inequity issues, those structural forms of violence that manifest in, condoms being used as evidence, sex work being decriminalized, folks just being prosecuted for Black and brown bodies and TGNC bodies. And so this, immigrants being treated as illegal. There's no such thing as an illegal person, right? The issues around intersectional stigma. And I say that because, folks keep bringing up stigma, but you ignore all of the ramifications that prevent or make folks vulnerable to HIV acquisition of gender identity, orientation, race, where I live, my community, and things like that. Issues we want inclusion of issues around quality of life and quality of care. If you ask a group of folks living with HIV, and I've asked our members, they will tell you healthcare, accessing healthcare is one of the greatest stressors. We've had a number of conversations where the emotions and tensions are flowing when women are sharing about their experiences in the healthcare system. I got here in my advocacy today about feeling raped on a doctor's table who decided to ask me, how did I get this? And then before I could answer, say, you probably don't remember, while he was giving me a vaginal exam before he saw my tears rolling. We are more than our CD4 count and our viral load. Our care cannot be measured by two indicators. If housing is treatment, housing is prevention. So, to focus so much on getting us a pill and using negative terms of adherence and compliances that don't apply to any other disease state is just insulting, patronizing, and paternalistic to people living with HIV. That, adherence and compliance. I'm a lawyer. Those are terms we use in the criminal justice system. I'm not surprised that HIV criminalization is still a problem when we even ourselves repeat those terms because they're accepted. We need to have funding focus on folks funding the most impacted in our communities. You cannot, keep funding the same organization, expect different results than the ones we're getting. Formalize mechanisms for MIPA. It's talked about community engagement. When you just use that term, we don't know who you're talking about. Because if you're meaning women living with HIV, then you need to say that. And we want formalized MIPA, or meaningful involvement for us, not the happenstance, not the inconsistent types of way. And, and I think, Breanna, you alluded to this in the beginning, formalized seats in places. This needs to be a part of it. And then I think Nana talked about the sexual and reproductive health rights. They're not typically addressed along our whole lifespan. Not only we might have been born living with HIV, but we are aging and we're living beyond the lifespans. We need prenatal information, we need sexual health, and we need information that contributes to our pleasure. We are not here for the prevention efforts of others. We are also here to live whole and vital lives. And then lastly, I'll just say, we need to continue to fund and build the leadership and inclusion of women and people of trans experience living with HIV. We demand racial justice in that, we demand gender justice, but you must build the leadership of folks, and we must see this as value to build the leadership of our folks to do this work and to be involved in any decision that impacts us. So thank you.
Absolutely. Thank you so much, Vanita, for uplifting so many recommendations from Demanding Better, as well as the priorities Positive Women's Network is pushing in the next iteration of the in-house and beyond. I know you touched on a lot of inequities and exclusion of populations and ways to include them. And so, Cecilia, how does the federal HIV response meet the needs of people of transgender experience living with HIV?
That's a really interesting question to answer, Breanna, because I think it wasn't until the Obama administration came in with this with the second national AIDS strategies that we actually started to see some languages that reflect the trans community in it, including, developing indicators. While everybody else is starting to have interventions, we were just there to develop indicators and start counting the numbers. But even with that, we were still short of like counting non-binary folks living with HIV, as well as like transmasculine folks with HIV. And it has been quite a journey, you know, in terms of like advocating for, you know, these inclusions, you know, but I'm happy to say that, you know, I think we have been working very closely with our federal partners. And so now they're finally implementing like data on trans men living with HIV, you know, under the HRSA's Ryan White client level report. And they just started collecting that, but hopefully, you know, like in the next couple of years, we will see more states coming on board, and we will see a better picture of exactly how HIV is impacting the trans men community. Imagine that 40 years later, we're still know very little about how HIV is impacting, you know, the trans men community. And I think that another thing is, you know, like Nana and Vanita both have alluded to that, is that, you know, these issues are not just one-off issues. These are all like they intersect each other, you know, like, and, you know, and Nana mentioned, you know, about, you know, like the whole national AIDS strategies, you know, like that we ask other countries to have, you know, and UNAIDS have been identifying these as key populations for years, and they have all these plans, you know, about like recommending policies and social enablers, you know, like, and how to empower these key populations, including men who have sex with men, transgender people, sex workers, and, you know, and also migrants, you know, and I think that it's really important to remind ourselves that, you know, there are still communities being excluded from, you know, from the national AIDS strategy, and that's sex workers and migrants. And, you know, and as for women's, the reproductive health piece, like, it's like a brief mention, you know, so I think that there's so much more that we should be doing, you know, in order to really get to where, you know, like our federal partners want the epidemic to be, you know, is to end the epidemic. But we can't address that, you know, if we continue to criminalize people because, you know, that they need you know, like survival economy, you know, in order to like continue to take care of themselves. And if they need someone to recognize who they are before they can get access to care, you know, in some cases, you know, like some cities, I'm not going to name the city and the agency, you know, there are still providers who would threaten, you know, trans women living with HIV that they're not going to get their hormones if they are not, you know, on treatment for whatever. So, and oh, by the way, that's illegal, in case you didn't know that. So these are the things that we're dealing with today. And, you know, and we are very committed to make sure that, you know, when we talk about the demanding better agenda, and also the trans agenda for liberations, that we talk about these intersectionalities, especially, you know, like on Black trans women, because they really, you know, are experiencing the brunt of, you know, like the adversity dealt to them.
Yeah, thank you so much for uplifting all of that, Cecilia. It's like, I mean, I heard like the need for data collection 40 years late, but even how data is collected, whether like how folks are able to self-identify, is their data secure, and then like issues with cultural competency in providing services that are safe and affirming. And then I love the comment about reproductive justice. I know we're going to hit on that, but I remember searching through the most recent iteration of the federal response. If you just control, you know, F search reproductive, it's like pops up one time, one or two times, and it's just like a sentence. So I think something as easy as that highlights how much is missing in the federal response for women and people of trans experience living with HIV. And so now I'm going to turn it over to Pat Kelly. You know, Pat, can you briefly unpack for us, how has the federal HIV response addressed issues that impact women aging with HIV?
There we go. Hello, everyone. Thank you so much for having me on this panel. And you asked a question that I am still looking for the answers for. You know, as I am a part of the new generation of people aging with HIV, there's so much that they don't know that they're still trying to learn as far as long-term medications that have been put into our system and the different health things that happen over long term. But for me, you know, I would like to say that I don't believe that they are really meeting my needs as a Black woman living with HIV and aging, because as I age, one of the things that I think that's most important to me is my quality of life. And I don't see where the quality of life has improved or they're making any strides on making sure that quality of life improves for me as I age. I feel as though my quality of life is going down because as one of the elders in the community, I should be receiving more help than what I'm getting now. But I found out personally, like when you turn a certain age, they stop certain stuff for you. They just cut stuff off and you don't know about it. And you don't even get a letter in the mail. I didn't get a letter in the mail at all when they stopped my medical. And then my case manager is the one that told me about it. And so I went to see what I could do to get that change or to get the help that I needed. But even also, if you're not, the quality of life really needs to be improved. Like they punish you if you have worked all your life. You know, if you worked all your life and you may make over $2 over the amount, if you get another chronic illness and you need care, you can't afford, they won't allow no one to come in and help you. You have to pay for that yourself because you made $2 over the amount. So you're being punished for trying to work and be productive in this society. And now they're saying, we can't help you because you got $2 over the minimum, you know. And I think that that's real important for people to start making plans for aging, because first of all, if you get sick and have to go into a nursing home, it's going to be just like it was back in the early time. They're going to put you over in the corner somewhere and just leave you there to die, unless you have somebody that's from your house that is really, really going to work with you to make sure that you're taken care of while you're in that nursing home. We need to create our own we need help from the federal government to help us create our own medical homes as we age and different chronic health conditions that we are already dealing with, because I'm 67, but according to science, because of HIV and the medication, I have a 70-year-old, 70-something, 77-year-old body and working with those conditions faster and earlier than I should have. But where's my help? Where is the geriatric care that coincides with the HIV care? And one of my biggest, I guess, pet peeve, so really bothers me, is the medical field. If I could talk about ignorance and stupidity, I truly believe that the medical field, it just rocks me to the ends when you go somewhere and the medical doctor talks to you like you have nothing up here in your head. You know, they talk to you, they talk down to you. They don't even have the education that they spent all those years in school to get when it relates to this chronic illness. So I'm just like, we need to educate medical students coming in how to talk to us. We need to educate medical professionals, care service providers, how to speak to us and how to treat us. Especially as you age, you don't have time for that crazy. You know what I mean? It's like, you want to just go upside somebody's head sometime and just tell them, you know, you are really just a stupid so-and-so and so. But we can't, you know, because we respect ourselves enough to have dignity in the way that we present ourselves when we have people acting ignorant towards us. I feel as though the federal government could do a lot more, especially when it comes to MIPA. How can you do things for me if I'm not sitting at your table? And basically because of that, South Carolina being a red state, being a native New Yorker, I come to South Carolina and I see so less that's here. These people don't even know the rights that they have. They don't even know how to go somewhere and speak up for themselves. They need help just on a general basis of, how do I speak to my doctor and tell them this medication is not working for me? You know, we need to be empowered. We need to educate people living with HIV. The federal response should do more education for our people. You know, they should do more education for their own people. You know, but I truly don't feel as though, you know, they're beginning the steps, but I am 67 years old. When will these steps be completed? To the federal government, I say MIPA is most important. I'm important. I'm the expert. You know, why do you talk down and think that I have no mind? You know, why do you think that the things you put out there to help in the system is going to help me if you're not living in this body or living this life? So I could rant and go on about things that they're not doing for a long time, but you asked me, what are they doing to help? If they sit down and have these listening sessions, once they listen, can you put some of the stuff we talked to you about into action and stop putting it over here on the side? Or, you know, like for me, and in the epidemic, they just threw money out there to so many cities and so many places. But what is that doing for me? What is that doing to end the epidemic? What is it doing to improve my quality of life or anybody else behind me living with HIV? You know, you want to end the epidemic, but like my sisters have said, once the epidemic is ended, I'm still going to be here. You know, you working on that, but I'm still going to be a person living with HIV or AIDS or whatever my diagnosis is. And I just wish that the federal government would really look at how important MIPA plays a part in all the work that is necessary to be done. How we as women, you can't do nothing without us. You know, we are the backbone of all men. You know, women are the ones that build people up, nourish them. And without us, what you gonna do? So my response to that would be the federal government really needs to open their eyes and listen and hear what we as women are saying when it comes to racial issues in the South. I'm not going to start, but anyway, they definitely need to make a whole lot of changes because the inferiority that so many Black people feel does not allow them to stand up and ask the questions and demand the things that they needed. But I am so grateful for PWN for being able to raise up leadership among women, among all women, and help us to get to where we need to be so that we can stand and fight and show the federal government that, hey, we're not going to stand for anything.
Amazing. Thank you so much, Pat, for all of that. Thank you. Martha, this next question is for you. How does the federal HIV response address the reproductive and sexual rights of women and transgender people living with HIV?
I was muted. So thanks, Breanna. And I know some of the other panelists who just rocked this house said a few things about reproductive rights and health. The short answer, Breanna, is that it does not. It never has. It never has mentioned sexual and reproductive health. I think the one comment or the one sentence that you're referring to actually was referring to pediatric health and adolescent health and talking about, you know, some of the young people making great choices, even though they're never really even educated about that stuff. So this is really critical. I mean, tomorrow, when the NHAS drops, I will be doing the same thing I've done with the past 3 NHASs, is just do my search for sexual and reproductive health. It's really weird because after 40 years, right, we know the interactions between reproductive health and HIV. We get HIV through sex, right? And it is associated with pregnancy, childbirth, and breastfeeding. We also know, and this is after 40 years, that reproductive ill health and HIV/AIDS share root causes, poverty, all the gender inequality and transphobia that we've talked about, social marginalization of people of color and other vulnerable populations. It's the same root causes. And funny enough, you know, in Nana's introduction, she talked about how before we had the national HIV/AIDS strategy here, the United States was demanding strategies and plans from other countries. Well, the international community actually agrees that an effective global response to HIV will not be had without sexual reproductive health, or without access to sexual reproductive health. So it always boggles my mind as to how up to now, we have not really addressed this. I mean, it is literally the role and the responsibility of the government to respect human rights, as we have been saying, and as we are demanding in our demanding better policy agenda, to protect the rights and to fulfill the rights. And reproductive rights are human rights. There was a question in the chat, I think it was from I'm not sure if I'm pronouncing your name right, and it had to do with essentially criminalization as it relates to you know, pregnancy and birth, I think it was. And you know, that is something as the international community of women living with HIV, we have been following, not just, you know, locally here in the US, but internationally as well. I think here in the US, it's really tragic. That's the word that I use, that women are, first of all, there was a survey that was done, I think it was by AMFAR, and it was found that people thought that women living with HIV should not have children. And one of the things we are demanding in the policy agenda, and as people living with HIV, and especially as women living with HIV, is that we do have a right to a sexual life. Nana said we have the tools. We can be virally suppressed. We have PrEP. We have the right to a fulfilling sexual and reproductive right. But not only do people think we should not be having children, but we are also in the US criminalized for breastfeeding our children, even when a lot of data shows internationally where women have been breastfeeding exclusively for 6 months and being monitored, that it is safe. So we are demanding in our policy agenda the inclusion of sexual and reproductive health rights for everybody, and especially for all women living with HIV in their diversity. You know, I think Cecilia mentioned that sex workers and immigrants are also not mentioned in any of the strategies. And these are people who absolutely need sexual and access to sexual and reproductive health care services, just as everybody else does. So we are demanding that it is recognized in the National HIV/AIDS strategy. We are demanding that people recognize that even as we age, we still want to have sex and enjoy ourselves. We should have access to a quality of life that includes our sexual and reproductive health rights. You know, Nana talked about PrEP as one of the tools. Even as recent as last year, women were not included in the trials for the most recent PrEP drug. And this is another thing that I think we need to be on the forefront of, in terms of the fact that 40 years into the epidemic, women are still being left out of clinical trials that would enable them to have access to whether it's medications or other things, as Pat was talking about in terms of geriatric care. We need to demand that there's research that includes aging, that includes sexual and reproductive health rights for women, for all women living with HIV. Thank you, Breanna.
Thank you so much to our stellar group of panelists for identifying all the ways that the federal HIV response is not meeting the needs of women and people living with HIV, people with trans experience living with HIV. So I know they've unpacked a lot of gaps and recommendations for filling those. And so I'm going to turn it over first to Nana, but this is going to be a question for all panelists to respond to. And so my question is, Nana, what do we know about the new NHOS coming this week, as in tomorrow? What do we know about it that will address these priorities that we've identified, and how have they been put forward?
Yeah, thank you. I think the first thing I want to say is that we have great federal leadership. We have a new director of the Office of National AIDS Policy, Director Harold Phillips. We have some wonderful leaders in HHS, in HRSA, in CDC, who really understand some of these issues and are committed to taking them up. And so PWN and the networks of people living with HIV have been raising the concerns that you've just heard here all year long. and many of these concerns we've been raising actually for more than a decade about the federal response. And so we're really pleased that we have heard indication from the Office of National AIDS Policy that some of these concerns and priorities will be addressed in the new National HIV/AIDS Strategy, which is coming this week. So for one thing, we know that there's going to be a very clear focus, as Vanita mentioned, on addressing racial injustice as a driver of the epidemic. That's going to be very explicit, an explicit commitment to equity, equitable resourcing around racial inequities, geographic inequities, and other types of things that really impact how the epidemic plays out. We also know that we keep using this word biomedical. What do we mean when we're saying that the response has been biomedicalized? What we mean is that what they're measuring for success in the last couple of national HIV/AIDS strategies and the Ending the HIV Epidemics Plan, which is the other major federal plan that came out under the Trump administration. These responses are the only way that they measure success is by looking at viral suppression. So are the viral loads of people living with HIV suppressed, and metrics like what is the number of new diagnoses, new HIV diagnoses. And I'm oversimplifying it a little bit, but that's basically what they're looking at instead of all these other factors. And so we know as people living with HIV that we can be virally suppressed and still sick, depressed, isolated, dying, right? And we can also be not virally suppressed and also dealing with all those things. And we need that. We need these issues around, like, are we stably housed? Do we have enough food to eat? Can we survive on the amount of money we're getting? Pat really articulated that well, right? Like, we have a system that has basically required people living with HIV to be poor in order to survive, in order to access housing and medication. And that is an outright human rights violation, right? So what we know is that the director of the Office of National AIDS Policy, Director Phillips, has expressed a strong commitment to addressing quality of life issues and well-being for people living with HIV, which is one of our primary asks. And so what we will see in this new strategy coming this week, among other things, is a new developmental indicator. That means it's a new set of metrics that is not set in stone yet. It is going to be developed over about a 6-month period to measure quality of life for people living with HIV. And we have asked for that measure to include things like, what's our financial security situation? Do we have food to eat? What's our mental health like? What's our measures of social support? Things like that, beyond just how are we doing on our HIV numbers. So that developmental indicator is going to be in the strategy. That is a huge victory. And I want to really thank and appreciate everybody who has been working to uplift that as a priority, to bring people living with HIV and our rights, our needs, our well-being back into the response. What we want is, and what we're demanding, is that the U.S. People Living with HIV Caucus, as the network of networks led by and accountable to people living with HIV, should be a partner in defining what those metrics are. So we want to be part of the federal agency work group that is going to be meeting for 6 months to decide exactly what will be measured. Nobody should be deciding that for us. They should be working with us, right? Nothing about us without us. This is about our lives. This is about our survival. And so we are demanding to be a part of that process and in partnership with the federal government around defining what quality of life for us actually means. We do not, we believe that there's going to be some language to address some priorities of including sex workers and immigrants within the strategy, but we do not believe that we will see them listed as a priority population, either of those communities in this new strategy. But it is our understanding that there will be some language speaking to those two communities as key populations. We do not believe that there's going to be a mention of sexual and reproductive health and rights. I know there was also a question about how does that show up. It does show up in criminalization. It does show up in in a lot of different ways around our human rights, but it also shows up in coercive sterilization and tubal ligations and stigma experience in within the context of sexual and reproductive health, and people of trans experience not being informed about their options for fertility preservation when when going through various kinds of healthcare processes. So these are just examples of the ways that the federal HIV response has kind of failed to address sexual and reproductive health and rights. And we're not sure that the new strategy is going to address that either. And then I guess the last point I quickly want to make is around one of our major demands, as Breanna lifted up as well, is around what does it mean to really partner with people living with HIV networks structurally within the context of the federal response. Many countries, again, going back to global examples, many of the PEPFAR countries in their country coordinating mechanisms, which are kind of their country level advisory bodies, they require a mechanism for civil society involvement in those advisory bodies. So that is basically kind of our analogy to PACHA. The President's Advisory Council on HIV/AIDS is the advisory body that kind of advises the government on what this domestic plan should look like, helps with monitoring it and advising on it. And so we are demanding that the PACHA, for the President's Advisory Council on HIV/AIDS, and other similar advisory bodies like CHAC, like ORAC, which advise the federal government on various aspects of the HIV response, these entities should be rechartered. Their charters should be rewritten to include 2 seats each for the US people living with HIV caucus to be filled by representatives of the caucus's choosing. That will ensure accountability, transparency, communication with a large constituency of people living with HIV, structured involvement from the most directly impacted communities of people living with HIV, and mechanisms for ongoing consultation with those who are directly impacted by these policies.
Thank you, Nana, for uplifting those demands. Martha, I'm sorry, are you unmuted? Did you want to respond to the question?
Yes. I think it was with regards, I think Nana answered it with regards how sexual and reproductive health rights show up in some of the strategies. Is that the question you're referring to, Breanna?
Yeah, so I posed to the panelists, what do we know about the new in-house coming this week that will address the priorities that we put forward today?
Right. Yeah, no, I think maybe just to expand on something that Nana says is we're really looking forward to the National HIV/AIDS strategy, even just mentioning and addressing quality of life. I think we really know now that, just being on our drugs and being virally suppressed is not what constitutes our quality of life, especially during the past couple of years with the COVID pandemic. Women living with HIV, I mean, generally women, but women living with HIV were heavily impacted in terms of isolation, mental health, and there was even an uptick in violence and other different kinds of trauma. And so just the fact that we will be considering a metric that is related to mental health, that is related to economic and financial stability, potentially. And these are metrics that, we discussed, and smart people among the people living with HIV networks came up with, and says, this is what we need to at least define our quality of life. And so we are really, really looking forward, and we will be watching the National HIV Strategy, looking forward to working with ONAP for the implementation plans of this strategy. So that is really key, and we are excited about it.
All right. Cecilia, you want to go? I'll go. So I want to uplift, I think, a couple of things that we still need to work on. I think Nana did a good job of kind of, putting that out in response to a question, as well as, we still, I don't think in-house or no one, even EHE, hasn't addressed how do we increase access to the full range of healthcare services, in rural communities. I mean, in the South, if you overlay where Medicaid did not expand, you can see where, rates are even rising higher. So the access to culturally sensitive and gender affirming healthcare is going to be still a huge issue. And I'm talking the range from mental health to substance abuse to, with women, infants, and children, just the full range of healthcare services for our folks, and uplifting the sexual and reproductive health. If we're not getting access to culturally sensitive healthcare, we're still missing the boat. Another issue I think was asked by someone in the chat, what responsibilities will health departments? Well, first, the federal implementation plan needs to be done, and that applies to federal governments. But we know that the federal government has its own hook, and that's funding, that it can direct, and through regulation and other ways, that it can direct folks to do differently, to end this implicit and explicit bias in healthcare that we see, maternal mortality rates that are still extremely high, the erosion of reproductive rights that we're seeing across the country and state governments that won't be addressed here, but still are gonna continue to be a need. And so health departments may not just have their marching orders. I think in-house just provides that strategy overall for the federal government, but I think the federal government has a role and can definitely impact the way that health departments and others respond on the ground that we need to talk about.
Okay, so I'll jump in now. There, we did talk about criminalization. So, first and foremost, decriminalizing sex work and decriminalizing drug use needs to be, on the table. And also, when we talk about all these different communities, there's another community that we often don't talk about. It's the community behind bars. And I'm not just saying behind prisons or jails, and I'm also talking about immigrant detentions. So if you are familiar with, some of the work that we've been doing at Transgender Law Center, you will know that we're representing a trans woman from Honduras, Roxana Hernandez, who actually passed away under ICE care in the detention. So we want to make sure that when we talk about access, it's access everywhere, where, our government touch, there needs to be access to medication. And also, the other things that I think it's really important is when we talk about, HIV and drug use, we need to talk about supervised injection site and make it a, a priority. And, and because Canada has been doing that and has a lot of data to support, the science behind it, so if they need evidence, the evidence is there, but because, we are waving the moral flag higher than the human rights flag, a lot of times, it just got disappeared. And one last thing is, we know stable housing is one of the key to good health outcomes. So, to really be able to help provide stable housing to everyone, it's really important. And last but not least, like this are the things that we don't talk a lot about is dental health. We all know that, like your teeth is your first defense to your health, but yet, like none of the systems actually cover, like dental health, so if you don't have teeth, then you would not be able to eat, and then you would not have the nutrition necessary to fight off whatever illnesses you have, let alone, HIV related complications.
Absolutely. Yeah, so with that question, I heard a lot of responses as to what the NHOS is going, what the new NHOS that is supposed to be released tomorrow is going to address is a developmental indicator of quality of life. And our demand is that networks of people living with HIV, such as PWN, Positively Trans, ICW, and the caucus are involved in the development of that indicator over the next 6 to 18 months. We have demanded the inclusion of sex workers and immigrants in the next NHOS, and while we know that sex workers will not be a priority population, we can continue that effort in supporting sex worker organizations that have been demanding that inclusion for decades. And another thing I want to uplift is networks of people living with HIV have been calling for a moratorium on molecular HIV surveillance for years. And for the longest time, this demand has been unheard or like intentionally unheard and not responded to by the administration. But we now know that PACHA, which many of the panelists have uplifted throughout this, this event, has been tasked by this administration, by ONAP, to hold sessions and recommendations and develop recommendations on the use of molecular HIV surveillance. And that is yet another reason why it is so important that PACHA, CHAC, and ORAC be rechartered to include 2 seats for networks of people living with HIV, as those sessions, as those recommendations must include networks who have been calling for a moratorium on MHS for years. And thank you so much, Nana, for sharing in the chat that we have developed a sign-on letter that you all can sign on to today as individuals or organizations calling for a moratorium on MHS until community concerns are heard and meaningfully responded to. Did anyone else want to jump in about what we know about the NHOS? Okay. No worries. Well, I know we only have 15 minutes left, and so I'm quickly going to reshare my screen to go over a few calls for action for folks here today, and then we'll turn it over to questions. So I know we've dropped in the chat a couple actions for you all, but I want to re-uplift. Oh, look, the GIF is making it silly. Apologies. I'll just do this. What are you doing? Okay, so we have 2 asks for folks today to take action. First, we ask that you tell the CDC that people living with HIV demand a moratorium on MHS. We've dropped the link to our letter in the chat. Please consider signing it on, have your organization sign on, but please, we have to let them know that we do not accept a molecular HIV surveillance. And second, please tell PACHA that people living with HIV demand institutional seats. We will also drop a link to sign on to this letter. Finally, we also recommend, we ask folks to please join PWN. You can become a member, and by joining PWN, signing up for our emails, you can stay up to date on what is in the NHOS and opportunities to take action to influence it and the forthcoming implementation plan. So please consider signing on both of these letters and becoming a PWN member. And so finally, I really want to thank, I want to thank our panelists for leading this robust discussion today on the federal HIV response and how it intersects with women living with HIV and people of trans experience. And we'll drop a couple resources for you all, including the Demanding Better policy agenda, an article and video on molecular HIV surveillance and the human rights implications of it, as well as a trans agenda for liberation. But with that, I really want to thank our panelists and thank you all. And I will turn it over to audience Q&A. So folks, if you have any questions, you can drop them in the chat and I will uplift them. Oh, and we can also raise hands. Yes, I forgot I can do that. You can tell. Oh no, where are you, Melanie? I'm looking for you to unmute. All right, Melanie, you may ask a question.
It's not so much a question, it's a response to what Nana just put in the chat. She wanted to discuss more about why we don't want it. I know why we don't want it, but I'm just saying, Harold Phillips, I was at the ANAC conference, November 11th, 12th, 13th, and 14th, and he spoke there and he was saying that molecular surveillance works. So that is not going to be a moratorium on it. And so we recommended that they need a federal response and resources for repealing HIV criminalization laws across the nation. And we didn't get a response when we asked that question, but yeah, I understand why they think it works, but we know why it doesn't work, because further stigmatized communities, stigma, people won't want to get tested, like they still don't want to because they're afraid of prosecution, either current partners or past partners. There's a whole slew of reasons why that does not work.
Yeah, thanks, Melanie. And
but unfortunately, it's not going to be recommended in the in-house.
Yeah, what we do know is that so people living with HIV networks have been raising concerns about molecular HIV surveillance for years, since we found out about it in 2018. And what we do know is that some of those questions are going to be taken up and addressed, as Breanna was saying, by the President's Advisory Council on HIV/AIDS, because there is such serious community concern about this. And so because not everyone on here might be familiar with molecular HIV surveillance, I just wanted to very briefly explain what we're talking about. So molecular HIV surveillance is basically a practice where genomic sequences of people living with HIV are taken without our permission, without our consent, and without our knowledge at the time of HIV testing, or at the time when a provider is helping us figure out our treatment options. These genomic sequences are taken, they're like uploaded to a database and compared with other sequences to basically determine if there are related viruses and public health uses this to sort of like assess what they call, like, quote unquote, like transmission clusters. So to see if there are a number of viruses that are closely related, where it's likely that, you know, they're kind of in the same transmission network, so they can direct public health resources to address those. The problems include, as Melanie has pointed out, HIV criminalization laws, which are on the books in almost 30 states, plus there are many more states that actively criminalize HIV without having laws on the books. But that is not our only concern about molecular HIV surveillance. It is also a broader issue. We do not have assurances that this data is protected from ICE, from Homeland Security, in other types of places. We also are concerned that this sets a very bad example for the way that HIV data can be collected, used, shared, stored. It can be stored, you know, kind of without indefinitely. In many states, there's wide variation at the state level in how this type of data is protected and how it can be shared. These are state level statutes that are really inconsistent. And So there's no real mechanisms for protection for people living with HIV. So just wanted to make sure that folks understand why this is something that people are so concerned about. People living with HIV are so concerned about, and we've even heard from people living with HIV that they're refraining from, or folks who might need to get tested for HIV, they're refraining from getting tested, or people are refraining from getting from exploring new treatment options because they're afraid of their sequences going into this database. Well, that just undermines the whole idea of, you know, getting people living with HIV into care services and things like that. So this is a big issue that and the actual technologies may change over time. But the principle of wanting HIV data to be secure, for us to actively consent to having our data taken and stored and shared remains the same. And that's why we're calling for a moratorium until these concerns are adequately addressed.
Thank you so much, Anna, for breaking down MHS community concerns and what we're calling for and addressing those. Do the other panelists want to respond to the question on MHS? It's a fun topic. Okay.
I think that Vanita actually covered a lot already, but if you look at all the published papers, you will find out, you will discover that, you know, like they're actually targeting minority community. So as much as they say that it's effective and it's useful, you know, like it's the first time that you would see them, you know, like tracing transgender sex workers in LA and also, you know, like Latinx men around the border. So so it just raised so many different red flags, and you know, like, and how they target minority community is a huge one.
And it doesn't even matter, to be honest, like the argument that it works, it doesn't matter. Quarantines also work. You know, putting all of us on an island somewhere also works. So it doesn't actually matter if it works. It's like, at what cost?
And I'm so glad, Cecilia, you alluded to the impact on communities that are already over surveilled. So let's talk about racial inequities and who the epidemic primarily impacts. People who look like me, Nana, Cecilia, Martha, and Pat. So these are communities, we know if we had marched on January 6th, y'all been burying us. So let's be real here. Just a Black skin alone will get you in trouble. So the reality is we're already targeted and over surveilled with policing and marginalizations of Black and brown bodies, and MHS adds another layer that folks did not consider when they implemented and released this. And so there's huge racial justice implications about doing, no law or policy is race neutral, but we know the impact of this one. So I didn't mean to go there, but thank you all.
You have to go there, Vanita. You know, and I wanted to uplift the fact that, you know, we also need to, as people living with HIV, push ourselves into some of these research, you know, academic spaces where some of these things originate. And, you know, they say they consult people, but we know that they have not consulted the larger community. And we know that there's a lot of these things happening, as Nana said, without our consent, you know, so we need to force ourselves into research spaces and understand what is happening with things like molecular health survey, because the MHS data, for example, in DC is being shared in all kinds of academic spaces for all kinds of research. It's readily available. You can go to a database. You can request the data from the Department of Health to be able to use in whatever academic space that you are to do whatever research you want to do. I mean, that's how widely it's being shared in DC. And, you know, we are members of, I personally sit on the community advisory board for the DC Center for AIDS Research. And I know that there's a lot of women living with HIV in some of those places. We need to speak out as we're demanding nationally for the moratorium. We need to let these academics know that this is not right as well.
one of the things that I've noticed in South Carolina, when we address them on MHS, they try to justify the reason why it's so badly needed. But they don't do a good job in doing that. And the more we ask them, the less they back up from trying to give us any information, because they really don't want us to know.
Absolutely. Thank you for unpacking all of that from y'all's perspectives across the US. So I know we have 4 minutes left. I want to make sure, did folks have any questions for our panelists? We have time for one more. Okay, yeah, thank you, Doug, for that comment. Yeah. Oh, you had a question in the box? Sorry about that, Chris. So yeah, Desiree Lyons or Chris Ardina is asking if the NHOS is dropping on World AIDS Day. If not, when is the expected time? So yes, our understanding is that yes, and the new National HIV and AIDS strategy is dropping tomorrow on World AIDS Day. I'm not sure if the panelists have a different understanding, but I believe that is when it's launching, and we are ready to thoroughly vet that document and to see what recommendations were included, watered down, or what was ignored, so we can make sure that we inform the NHOS implementation plan that comes out in January of 2022, as well as the ending the HIV epidemic that is going to be revamped in 2022 as well. Anyone else want to respond to that? Okay, cool. No problem, Chris.
I'll just say stay tuned also. We are expecting it to come. The president is also doing an event tomorrow that will be live streamed on the NMAC website at 2:30 p.m. Eastern, I believe, talking about what's in the new National HIV/AIDS strategy. So keep an eye out for that. If you follow hiv.gov, that's a good resource to learn about what's coming from the federal government. Also, of course, if you continue to follow at USPWN, we will keep you informed and updated on things that are happening, including any community analysis of the strategy that's coming. I know that the caucus will be hosting a listening session coming up before the end of the year, and there will also be some other opportunities for people living with HIV and allies to get together and talk about what's in the strategy.
Awesome. Thank you so much for that, Nana. Thank you so much, everyone, for tuning in today. We really appreciate it. I want to spend the last 2 minutes, if our panelists have any final words about the federal HIV response and recommendations, you can briefly provide it. So I'm going to start with Pat. What are some takeaways for folks today about the federal HIV response and women living with HIV?
I truly believe that when it comes out, we need to keep a watchful eye and be aware what is there and what isn't, and then try to check and see how will these changes that they're trying to make play in our own communities. Because here in South Carolina, things get rolled out really slow, and the connection with the federal government and the local area is. So we need to be prepared. Keep a watchful eye.
Vanita?
Yeah, I think we've said a lot, but even if you don't think that you can stay up to date, stay tuned to PWN's website. We've said a lot here. Download the Demanding Better policy agenda and begin including what you heard here at the tables you sit at. Begin elevating these conversations. We know that the others there are not telling you or speaking in the same way that we're speaking and uplifting this. So these can become talking points. Yes, become a member, but download the Demanding Better, start talking about quality of life, aging, that we are more than our viral load and CD4 count, and then reach out to us if we can be of help.
Nana.
Yeah, and oh, go ahead.
Go for it, Martha, sorry.
Yeah. No, I just wanted to continue uplifting, joining the bandwagon of these powerful women living here. We all represent different networks, but it has been such a huge benefit to be a part of the PWN family and be able to join in some of these advocacy issues. Listen, we have an opportunity with this current administration to change the trajectory of what the quality of our lives will be with people living with HIV, even after this epidemic ends. And so you want to be a part of this. And so I just encourage you, some of the others have said, just keep up to date and join us and, be loud at whatever table that you're sitting at. If you need the information, we'll give it to you.
Cecilia.
So I think that, there's so much covered already, and I would encourage folks to continue to refer to, the federal policy agenda, and also, the Transgender for Liberations on our website, Transgender Law Center website, and hopefully, that would be an ongoing conversations. And there's no strategies that's strategy is not dead, strategies is alive. So we have the power to change some of the narrative if we don't think that it's working for us.
And Nana, any last closing remarks?
I think just to pick up on what others have said, HIV activists and people living with HIV have never just stood silently by and let things just happen to us, and we won't do it now. And women, especially Black women, women of color, trans women, have always fought to really push the agenda and to expand the lens on what our communities truly need. And so, in honor of everybody who's come before us, in honor of all the people we've lost, I know many of us are really sitting with that this World AIDS Day, a lot of grief, a lot of loss, some giants that we've lost recently. And just in honor of everybody who has paved the way for all of us to be here, let's keep fighting. Let's keep doing this because our communities deserve it. Thank you.
And with that, thank you so much to our incredible panelists for unpacking the federal HIV response and what women living with HIV demand. And thank you all for joining us today. We appreciate you all and look forward to advocating for what we demand together. Thank you.